We take you here now. President Cyril Ramaphosa says the coronavirus has helped the state improve service delivery. He's in the Eastern Cape to assess the province's readiness to deal with the outbreak. The president's admitted there have been some minor setbacks, but he says the state will continue to improve its capacity.
We've always said that the capacity of the state is one of the biggest challenges that we face. And as we are dealing with COVID-19, we can see how the capacity of the state is improving. And even as we are traversing uncharted waters, we are going where no government, and may I repeat, no government in the world has ever been to. Those are the waters that we are traversing. And sometimes there will be missteps, but most of the time we're getting it right. We're getting it right to save our people's lives. And the capacity of the state has now come to the fore. We are beginning to do a lot of things in a much more purposeful way, more effectively. We're meeting much more regularly.
The president says the country will be moving to level 3 lockdown. His address to the nation last night was met with confusion by some on social media.
This country, yes, is bound to go from level 3 as well to level 2 and finally level 1. We are not stuck in level 4. I need to make that very clear. We are now going to migrate to level 3 so that we can loosen up a number of restrictions so that the economy can start operating once again. And we have said from the onset that our purpose is to save lives, but at the same time to save livelihoods.
Right, let's take you to the Eastern Cape now, specifically the Nelson Mandela Bay Stadium. And of course, the president is in the province assessing the province's state of readiness to deal with COVID-19.
But surely, with all the challenges of this phenomenon, it's unprecedented as it has been explained. So we are learning with that. We are on that learning curve as well. As much as we're trying to flatten the curve, we are also on a learning curve. So I think with the valuable inputs we got from minister as well as president today, they really inspired us more, really helping us to recalibrate our system in ensuring that we are able to be effective on responding to the issues at our disposal. So there are issues, there are a lot of challenges that we are dealing with every day. The issue that we want to say to everyone, give us a chance, give government a chance, work with government. We are calling everyone, we are working with everyone in the province, traditional leaders, civil society, churches, all of them, they are participating in our extended command council. So we are quite happy with the political support that we have from all political parties in the legislature, of which we are also regularly briefing as the executive. So work is out there, numbers are really surging, and we're trying to contain numbers. Our strategy is talking to that, and definitely we're trying to make it a point that we fundamentally disrupt the transmission of the novel COVID-19 so that it doesn't really get into our most vulnerable people. Already it is with them. We are feeling it, but we are finding better ways of really dealing with it, annexing it. We had outbreaks in rural areas, Port St. John's, Lady Frey, where we came in very hard, try to arrest the situation. We have seen that system working there. It can work anywhere. But so far, thank you very much. We really appreciate the national support. Looking forward to the arrival of Cuban brigades as they are coming in to reinforce our teams on the ground. Much more support as we are calling for that from the minister as well as from the president, even in other sectors. We definitely need the economy being reactivated so that our people can also find peace with their livelihood. So we're looking at all those broad issues across the socio-economic spectrum. Thank you.
Thank you, Premier. Minister?
No, thank you very much. We're very pleased with the President visiting Eastern Cape. As you are aware, President has been visiting a number of provinces. He's still going to continue. So we find this very, very helpful and encouraging. there were a few issues which we were focusing on in the province. First was to ensure that they've got a strategy to intervene in dealing with the rising numbers. This has been tabled to me and to the President, and therefore we're very pleased that they've adopted that strategy of focusing on hotspots. The second issue that we had ensured that they must focus on is the issue of augmenting human resources. This again, they've indicated that they are working on, and we have seen the number of nurses that have been employed, and there are also doctors who are going to be employed very soon. And then the third area was the area of protective clothing. This has been a sore point for a long time, and in this case we have sent the last two visits I was here, we brought in the chief procurement manager from the Department of Health to come and look around to see what is the challenge with PPE. We realized that the real issue was the systems of being able to manage the stock in the district, so that one hospital can have stock and the other one doesn't have. We need to be able to deal with that. To also deal with the issues of training on what level of PPE you need for what level of protection and so on. So that work is being done. Now we have seen that there are some protests that are coming up. A combination, some are still raising the issues of PPE, and so we believe they must deal with that. The last one was infrastructure. We came to show the President on the extension of the infrastructure, new beds. So we're very pleased with that, and so I want to just leave it at that, because it was really for us to come and account to the President that some work is being done in this regard. Thank you.
Thank you, Minister. Sorry, before we get the President, can we ask that you move a little bit this way? Some space? Yeah.
And have you heard about something called social distancing? Doesn't look like you are observing.
Fine. Okay. Mr. President.
No, thank you very much. I've been very pleased to be here and to have spent quite a number of hours with the Minister of Health, Dr. Mkhize, as well as our Premier and the MEC of Health and other MECs. It's been a very fruitful day, a day of good engagement, where the province has been able to give us a full explanation of a number of things that they are working on in relation to COVID-19. We were obviously concerned and are still concerned about the rising numbers of infections in the Eastern Cape. They have been able to lay out their strategies of dealing with COVID-19 and taking really aggressive action in relation to seeing how best we can reduce the high numbers of infections. They've addressed the issue of human resources. They've brought in a number of health and community workers who are going to do screening so that testing can then happen. They've taken preparatory measures in terms of setting up field hospitals in a number of areas, so that those who get infected are admitted and are treated properly and humanely. Like here at this stadium, there are people who have already been admitted and who are being treated. And we went to Livingston Hospital. Some had been admitted, some have now recovered and have gone home. And they've also been able to outline to us some of the challenges that ordinary people are facing. The Eastern Cape is one of the poorer provinces in our country, where there's grinding poverty in a number of areas, and we've got about 400,000 households that live below the poverty line, and that is a major concern to the province and to us, and they've had to utilize their own money to try and address this, and we will be assisting them at the national level as much as we possibly can. And they've also been able to outline to us the challenges that are going to ensue post-COVID-19. In fact, as we speak now, this is playing itself out, the economic challenges with a number of companies facing serious difficulties, and some may even face greater difficulties in a few weeks to come. So the economic challenges are huge, but what was pleasing is that they are already looking beyond COVID-19. They are looking at the economic recovery that must happen here in this province. And we're going to see how best we can assist the province when it comes to the broader economic recovery that we need to embark upon as a country, as a nation, to try and save jobs, but also to create more jobs. So there's a lot of work that needs to be done. But I was very pleased to see that the province is working very hard to try and address all the challenges that we are facing right now. And the health response, they have really taken it up seriously and are doing everything they can. And I was pleased to hear that they've already screened more than 1 million people, and the testing is going up. And of course, they need more PPEs for medical staff, and we would like the medical staff, the health workers here to get the personal protection equipment that they deserve, because they are putting their lives on the line for all of us as South Africans, because they are taking a huge risk. So we want to protect them. We want to make sure that when they go out to work amongst our people, either here in this stadium or in other field hospitals that are going to be set up, they have the security of knowing that they are well protected themselves. So we will be taking steps to give them that protection through our procurement system. But all in all, I think a visit has been a really good one, and the province has demonstrated to us that they are up to the task. They are able to ensure that we lower the curve of the infections, and I have no doubt that they will. Thank you very much.
Guys, I'll take 3 questions maximum. Do you have your hand up? Governor, you're 1, Cyril 2. Okay, I've got 2 questions. Go ahead.
Mr. President, Governor Whittles from ENCA.
How are you?
I'm well, thank you, sir. Good to see you're well, too. What do you think of the debate around the mandatory hospitalization of patients that have coronavirus in order to stop the spread of the virus anywhere else?
Well, I think it's once you have the virus, as the doctor will say, you become infectious. So what we've been saying is that once you have it, we've got to have you isolated, because if you're not isolated, it's likely, and it's not even likely, it's a sure case that you're going to infect a whole range of other people that you'll be in touch with. So it's not a violation of your rights, it's actually the securing of the rights of other people and your own life as well. So we believe that it is a correct thing to do, that those who have the virus should be put in hospital so that we can manage the virus and try and, 1, isolate them, and 2, make sure that we manage it and we help them and to get their bodies to be in a situation where they can fight the virus. Because we don't have a vaccine, we don't have a cure, so it is important for the sake of others that they should be in isolation and quarantine.
Thank you. Susan, you had a question?
Mr. President, I would like to find out, I'm sure most South Africans are interested in this. By the way, my name is Anda Ngonji from SABC. I would like to know, when can we see the Cuban doctors, beginning to get into action? We know that they've been under quarantine for quite some time now. When will we see them coming to us?
Well, this is the man you should be directing the question to. So I will pass on this one, because he is the boss of the Cuban doctors. So Dr. Mkhize will answer that one. What I did was to call the Cuban president and ask him to send us their top specialists to come to South Africa. They are now here, and Dr. Mkhize has received them, and he's the one who is deploying them throughout the country. And I'm really pleased with the plan that the minister has laid out to have them deployed to all the provinces of our country. And I'm also glad that the Cuban government has deployed as many as they have to come to South Africa, because we have a very special relationship with Cuba, which emanates from Madiba's time with Fidel Castro, and we are very proud that we've continued with that tradition, even ourselves who have succeeded Madiba in carrying out the work that he and Fidel Castro carried out. But Minister Mkhize will answer that.
Mr. President, you have answered the question. They'll be out anytime. As soon as we are ready, they're being orientated now. So when that is done, they'll be ready to come through. The President is right. We're very happy.
Thank you. Last question, ma'am. You have a question?
President Farah from the Burger newspaper and Network 24 News. Can you perhaps give us an estimate as to how long the consultations will take before announcing level 3? And also, will the sale of alcohol and cigarettes be legal then?
Wow. I knew the cigarettes and alcohol will come up again. No, the consultations are starting tomorrow. We have already said that we are moving to level 3. What we are really consulting about is the measures that should be part of level 3. And that's what we will be really focusing on. So we're starting consultations tomorrow with MEDLEC. We'll do our provinces the following day, and we will do a whole number of other parties. And this is the way we work. We want every South African to be part of the process of embracing this level that we are going to. And I want to repeat again, we are not forever sentenced in these coronavirus levels. We are going to get out of these levels and resume our lives. But when we do so, we should be in a position to have the tools and the instruments to enable us to change our behavior, to change the way we relate to this virus, because this virus is going to be with us for a very long time. Now, as regards tobacco and cigarettes, I think let us wait for that moment when this matter will be dealt with and finalized. Thank you very much.
Thank you, Mr. President. Thank you. Thank you, ladies and gentlemen.
We're fetching 2:30. Hello and welcome to it. If you're just joining us, those are visuals from the Eastern Cape, where President Cyril Ramaphosa has just concluded his trip in the province, assessing how they've been dealing with COVID-19 and trying to flatten the curve there. An all-round president seeming to be quite satisfied there, but also noting some challenges that still need to be addressed in the province. Some million people having been screened there, but still infection rates are quite still high. My colleague Govan Whittles is there. And Govan, the president giving the Eastern Cape the thumbs up, but still more challenges on the road ahead. Well, Govan Whittles, unfortunately, it doesn't seem that he is there with us. But as soon as we establish that connection, we'll take you back there.